Hi, my name is Dana Shulo, and I'm the Research Associate with the National Down Syndrome Society. I'm joined today by Dr. Jonathan Santoro. Dr. Santoro is a pediatric neurologist at Children's Hospital Los Angeles. He's the medical director of the Neuroimmunology and Demyelinating Disorders program there, as well as an assistant professor of neurology at the Keck School of Medicine, USC. He is the country's leading expert on Down syndrome regression disorder. Dr. Santoro teamed up with NDSS to create the Down syndrome regression disorder checklist for families. Thank you so much for joining us to let families know about this new resource.
Thank you so much for the introduction. Obviously, Down syndrome regression disorder is a passion area for me, but I do want to say before we get started and go through this checklist it really should be used as a tool to see if the symptoms might fit with Down syndrome regression disorder. Ultimately, if you have a concern, we still want you to seek care from your primary care doctor or your subspecialist neurologist or psychiatrist, but this can be used to see if maybe we should be considering this diagnosis more so than something else. So with that, we break Down syndrome regression disorder into 8 symptom clusters, meaning that there's kind of broad categories of the symptoms that individuals with this condition might experience. This is based on the diagnostic criteria, and I'll go through a little bit more on this, but we often see behavioral changes. This can be anything from a loss of activities of daily living, or inability to do things like toilet oneself, eat oneself independently, or do things like catch the bus, which they were able to do before. Changes in thinking. This can be a confusion or a disorientation. A loss of functional or social skills. Often we hear that it seems like the individual suddenly has the symptoms of autism, even though they had not had that diagnosis or exhibited those symptoms before. Obviously, new seizures or focal neurologic deficits, meaning weakness, numbness, or being off balance. Those are always things to get evaluated for very quickly, if not immediately. Difficulty sleeping, language difficulties, and specifically a loss of language. Irregular movements, and the term that we use frequently with this is catatonia, or a stiffness of the muscles. And then obviously mental health or psychiatric symptoms. This can be anxiety, obsessive compulsive tendencies, or frank psychosis, hallucinations, things of that nature. When we talk about what we do with that, it involves a lot of testing. Down syndrome regression disorder is a diagnosis of exclusion, meaning that we've looked at all of the other possible medical diseases that individuals with Down syndrome could get, and we have ruled them out with a variety of tests. That can include pictures of the brain, which is called an MRI, blood work, urinalysis or urine testing, a lumbar puncture, which is sometimes referred to as a spinal tap, an EEG, which puts electrodes that are non-painful on the scalp to look for seizure activity. Also, we can do genetic or metabolic testing, and then some patients will also get a polysomnogram, or a sleep study is the other term for that. There's not one specific treatment for individuals with Down syndrome regression disorder, but a lot of the tests that we get are designed to provide us with information that may make us able to suggest the best possible treatment based on the symptoms. It's always best to seek care from a multidisciplinary team that involves psychiatrists, neurologists, primary care doctors, geneticists, because ultimately everybody's regression or the symptoms of regression may be caused by many different things, and you may require specialty care from one of those different types of doctors. Some of the most commonly used medicines for this condition are benzodiazepines. The most commonly used is lorazepam, which is also called Ativan. That's usually used to treat the symptoms of catatonia, or that muscle stiffness that we were talking about before. Antidepressants, again, this comes from literature from when we thought that this was a factor of depression. But antidepressants actually work regardless of the cause of regression and may be added to your loved one's treatment protocol, even though the primary diagnosis may not be depression. Antipsychotics are also used. These can be used for behavioral issues or hallucinations or poor sleep. So again, another symptom-based medicine. My specialty area is immunotherapy, so treatments for the immune system. A minority of individuals with Down syndrome regression disorder may have an immune basis for this, just like we see many disorders that are in persons with Down syndrome have an autoimmune cause, like celiac disease, type 1 diabetes, or Hashimoto's thyroiditis. You can also have autoimmune disease in the brain, and we think that some cases of regression may be caused by this and thus may be responsive to immune-based treatments. Lastly, electroconvulsive therapy sounds very, very scary, but it's one of the most effective treatments for this condition as well, but we usually reserve it for the more refractory cases, meaning you haven't responded to those other treatments previously. So the checklist is designed to take those 8 core symptom clusters and use that to kind of determine maybe I should be seeking care or not. The way that we think about it is for our diagnostic criteria, having 3 or more of those symptom clusters is often enough to actually meet the criteria for getting worked up, whereas having more than 6 of 8 of those clusters is actually indicating that this diagnosis of Down syndrome regression disorder is probable. That doesn't mean that you skip any of the testing. It does mean that we still need to kind of get everything and be very thorough in our assessments. But at the same time, this is the point where you should be seeking out medical care and engaging with your doctor or your primary care doctor about the possibilities that your loved one has Down syndrome regression disorder. I've included a link here. This is a publicly accessible document for everybody. It is written a little bit scientifically, but it has the recommended testing that we have generated for Down syndrome regression disorder and the specific criteria, which I've listed right here as well. And this doesn't require a subscription. You just click on the link or access the link online, and you can review that in great detail. This is something that is also very helpful to bring to your primary care doctor or your subspecialist doctor if they have not heard of Down syndrome regression disorder as well. Thank you so much for your time, and I'm hopeful that this can be a helpful tool for individuals moving forward.
Thank you so much for sharing that with us, Dr. Santoro. NDSS was so proud to have worked on this resource with you. You can download the resource at ndss.org. If you'd like more information, feel free to reach out to us through our social media channels or through our website.